So I'm going to demonstrate giving a treatment on my lovely volunteer Anna here, just to show you the possibilities of being really intuitive, flexible, and making your treatments a bit more diverse than just following your normal routine, which I think a lot of reflexologists get stuck in, and they just do the same thing for each treatment, and then it becomes a little bit mundane, doesn't it? So to be able to be more flexible and more creative in your reflexology treatments is what I'd like to demonstrate today. So I've already cleaned the feet, and then I'm going to just hold the feet and check the alignment to start with. And probably can't see from that particular angle, but I can notice that the right foot is just that little bit slightly longer than the left, so I want to physically pull this left leg and really stretch out those pelvic muscles on that left side. And I really want to start the treatment by getting the feet aligned. Don't be afraid to maneuver the feet into a better position. If the feet were, away from the midline or towards the midline, you want to get them to be straight. And as you're working on each foot, make sure it's in this straight position, because it's amazing how you can correct musculoskeletal problems and help to alleviate muscle memory held in tight muscles, especially when the feet are more aligned. And I'm assessing the feet as I am just holding them, and I can feel this imbalance, let's call it imbalance or congestion around this pelvic area. I don't know if you can see that this all looks a little bit puffy, doesn't it, around the sacroiliac here, the pelvic area. A common place to note where there's a little bit of inflammation is this area underneath the ankle, which is all the pelvic muscles like your quadratus lumborum and your piriformis. So that certainly is evident on both feet, and it just feels a little bit like it needs the extra work and attention. Maybe a lot of work on the lymphatic area around this pelvic area would be a good plan for my treatment today. Other than that, they look a pretty healthy pair of feet, reasonably upright and straight, and yours tend to note that there's a bit of hard dry skin on this point here, don't you? On the neck, cervical spine, C1 and C2, and slight misalignment of the big toe, so I would anticipate that there's some work to be done on the neck and shoulders, as you find with most of your clients these days. But other than that, they look pretty good. So I'm just going to put a little bit of balm on, and whatever medium that you use, ideally so it's not too greasy or slippy. You need a medium where you can maneuver around the feet, but not to slide too much. The whole art of reflexology is to be precise, isn't it? So if you are being a bit sliding off a particular reflex, then it's not going to be as effective. So I really just want to get to know the feet first before I start. Spending a bit of extra time on just again trying to lengthen that left leg, working around that slight inflammation around the pelvic area. Always good to do lots of work on the lymphatic circulation as you are giving your treatments. One, it just feels nice, it feels like a relaxation technique. And a really great place to start, because if you get to move all of that lymph, as in moving all of the water flow throughout the body, and that all becomes more efficient, then that can really help to alleviate any tension held in the fascia, help to really release tight muscles. So just to get all of that fluid to move. In fact, as I'm doing this on Anna's feet, it feels a little bit congested actually. So it makes me want to ask about hydration. Do you hydrate well?
Fairly well, I would say. Yeah, some days I'm probably better than others.
So whether it could also be maybe down to being sedentary, the lymph gets a bit stuck and stagnant if you've been sitting for long periods of time. I know you've just had a 2-hour car journey, so it could be just as simple as that. So my goal right now is to just get all of that to move, especially around the pelvic area. Again, lengthen out that left leg. think of yourself as being like a chiropractor at the same time as giving reflexology. So you're really trying to strengthen and straighten all of the bones of the feet and all of those tendons in between the bones. You can have like a release of fluid, synovial fluid, get everything to just be more manipulated. Okay, so I'm ready to start. So I'm going to just work on the right foot to start with. So would you mind just bending your knee and taking that leg away so we can see the right foot? There we go, that's pretty clear. Okay, spreading of the feet is a nice relaxation technique. Again, working on loosening up all of the bones of the feet. Check the neck. So I just crooked the big toe then, so it's just a good sign when you feel that, like a creak or any kind of release of any tension held in the foot is always a significant thing for that area, for that reflex. And as I'm working over this big toe, it's all quite tense, particularly here, the back of this big toe where you've got your sternocleidoid mastoid muscle going down to this area. Here you've got the trapezius. It's all a little bit crunchy. And let's check here the deltoid, around where the shoulder is. And again, there's lots of congestion here. So work the two areas together. Work the neck with the shoulders. And can you see I've got my fingers working on the dorsal aspect as well as the plantar aspect, so I can work both sides of the feet at the same time. Remember, they've got the front of the neck, haven't you, at the front of the big toe. And that makes a lot of sense when you're working with muscles. Muscles work either in pairs or in threes, so working all those muscles that relate to holding the head upright is a good idea. And the more you vary your angle and your techniques, the more your treatments will be more effective. Don't forget that the front of the neck also holds lots of tension. I think a lot of people focus too much on the back, where often it's the neck that feels tighter. And already that's loosened, hasn't it? Okay. So as we were really thinking about all the musculoskeletal issues, as Anna is a potter, that we want to actually focus on these first. So by this technique, I'm using my index fingers on the top, my thumbs underneath, but I'm bending my middle fingers and I'm using the joints of the middle finger on both sides, medial and lateral sides, to make small circles. This side, I'm working on all of the reflexes for the spine, and I can feel that there's definitely certain tension there at the base of the thoracic. And on this lateral side, I'm doing exactly the same thing and checking out all the joints. And again, the elbow knee feels like it needs a bit of extra work. And then doing the two sides together, so I'm really manipulating the foot. Hopefully that's not too much pressure.
Yeah, that feels lovely.
And as I'm doing this, I'm keeping the foot straight, keeping it aligned. So I've assessed all of the spine and the joints, and I can feel that this area down here, like base of the T12 and beginning of lumbar, feels like it was the tightest. So I'm going to go in there with my index finger now and work it a bit more thoroughly. How's that feel?
Definitely tender, but very capable.
So this precision, I'm using just the point of my index finger to work. Base of that first metatarsal bone is the base of your thoracic, so that's T12. And then I can pinpoint exactly where lumbar 1 is, 2, 3, 4. 4 feels tighter than the others. And then number 5.
Yeah.
L4, L5 definitely needs to have a bit extra work. So you can just hold on that point. Don't be afraid that it's going to be maybe a bit painful for a while. It generally is short-lived, and it's amazing to feel like the difference, the release that can be in a, was once an acutely painful reflex, hopefully feels easier.
It's easy. Yeah.
Don't have to say that just because I'm filming it if it's
no,
not
it
easier.
really is. It really is. It does feel like it's easy.
Okay, so on that point, L5, what did it start off as?
I would say it started off as quite a sharp pain.
So give me a number from 1 to 10.
Probably a 7.
Okay, and then what would you say that is now?
About a 4, I would say.
Okay, so that suggests, doesn't it, that it's already been rebalanced, and that is enough work to be done on that. So I'm going to carry on just going down to the coccyx and then back up again. So I'm following this slightly lower path now, and this is all the muscles that support the back. And it's often this area here that feels tight. So just below the arch of the foot where I followed the vertebrae, I'm going to follow this area, which is the big muscle that spreads over the mid-back, the latissimus dorsi, and that all feels tight, doesn't it? So we can release the muscles that are supporting the back, then it can help for the back to get back into a better position and realign. Okay, back to those muscles around the neck one more time. So keep repeatedly going back to areas that needed the extra work, and hopefully all that just not tender anymore.
A lot less tender than it was.
Okay. Straighten the foot. It's got a tendency to go towards the midline, so I want to straighten it back out again. Thank you. And then work the diaphragm. Getting a really big curve as the diaphragm goes all the way down, has attachments down to the level of lumbar 2, and can hold tension like any other muscle. Solar plexus. And then I'm going to add the throat with my index finger on the side of the big toe with the solar plexus. And then let's work the lungs, which often can hold a lot of emotion rather than respiratory issues, which you might find there's lots of congestion held in the lungs, and more often than not it's all emotional. And again, I'm working both the plantar and the dorsal aspects to try and loosen that up. And you see, I'm trying to work the congestion up and out. Imagine trying to let it release. Now, interesting, as I'm working over this area, I can feel that there's a bit of built up hard dry skin on that point there. Now, although I'm on the right foot, you do have some foot charts that show you that the heart can also be found on the right, and it is right in the middle of your thoracic cavity, isn't it? So the fact that there's this bit of area of congestion there, I would anticipate that it's the heart rather than lungs, because the rest of the lungs felt actually fine. So I'm just going to hold on that point there. I would imagine that there is the same bit of hard dry skin on the left foot too.
I think so.
Is there?
Yeah.
So the heart's an interesting reflex to talk about. Most often it's not because someone's got issues with their heart. Quite often, again, it's emotional, actually. I'm not sure that would apply to you.
Possibly it could. Yeah. Yeah. Bereavement 2 years ago.
Yeah, that would make sense. So my working this area, I'm realising it's a sensitive area, and my intentions are to release that emotional stress, if you like, trying to let that go from that person. Your intentions are a powerful thing, aren't they? Your thoughts can create things in your life, and us as reflexologists, we can really help to create, positive outcomes for our clients by thinking positive intentions towards them. Okay. So imagining letting that emotional stress go, and helping that to release. And then let's work the toes, sinuses. You've got lots of reflexes going on in all of the toes. But initially, I am intending to work the sinuses. And then I could also work the cranial nerves. You've also got like the top of the toes are like parts of the brain. In fact, all of the toes represent parts of the brain, don't they? Everything above this line represents everything in the cranium. Maybe slightly congested, slightly painful?
Little, yeah, I would say. The third one is the sorest.
Yeah. Interesting, because you've got all of the meridians that begin or end in the fingers and the toes, but this one, interestingly, does not have a meridian begin or end in it. So I will then conclude that it's more sinus-related problems rather than meridians. So let's check everything to do with the sinuses. You've got the ear. Make sure you go right in between the toes to work the ear, and that feels congested, doesn't it?
Mm.
And then the eustachian tube.
Oh, here's just popped.
Oh, that's a great reaction. So when you get these instant kind of physical reactions, it really validates exactly all these corresponding areas that you can find on the feet. Have this direct communication with the organs themselves.
Yeah.
Now, how's that eustachian tube?
Yeah, that's fine.
And we've got the eye. And let's just double check the nasal passages at the front of the big toe. Seems okay. I'm going to go back to that middle toe. Slightly easier, but still needs a bit of extra work.
Still a little sore.
We'll come back to that in a minute. Let's go back to the ear. So being thorough, keep working over these areas that need the extra attention. Feels clearer to me, that ear reflex, so I'm happy with that. Back to the eustachian tube, and I'm just going to work the throat, because all ear, nose, throat all connect together, don't they? All part of those respiratory passages. Okay, I'm going to work the lymph again now. One, because it just feels nice and relaxing, and two, I keep wanting to get all of that fluid to move. Feels a little less congested in the pelvic area now. I'm going to come down the lower leg, down through the sciatic area and all those pelvic muscles. Let's work that back up and back down again. Loosen up those pelvic muscles a little bit more. that shoulder, the neck, and let's knead that whole thoracic cavity. So I've pretty much worked all of the musculoskeletal areas, which all feel a little bit easier. I've worked the neck and the shoulders, and I've worked the diaphragm and the lungs and the sinuses and all the toes. So now I want to work all the abdominal cavity. So I'm going to start with the not the thyroid, I'm going to start with the vagus nerve just underneath the thyroid. At this point, I want my treatment to become a lot more relaxing. I've done all the important areas, so all the painful areas should be out the way by now. And when you're working the whole digestive system, you want your treatments to maybe slow down a little bit. You want the digestive system to be calm, slow, efficient, and that starts with that vagus nerve, calming everything down so everything's in that parasympathetic state. Hopefully that feels okay. And then I'm going to hold the stomach meridian point on the second toe. You may not have learnt this, but there is, have a look at some meridian charts. You'll see that all the meridians begin or end in the fingers and the toes. And you have significant well points in each of those fingers and toes where you can access these acupressure points. So I'm working the stomach meridian there, and I can add the stomach as an organ, as the reflex, with it. So I'm working both at the same time. Interesting, that just feels just a slight congestion there. Kind of just underneath where the esophagus starts. So I'm going to go up the esophagus and check that out. Feels okay, but I'm going to come back down as well. And it is tight at the base of the esophagus. Quite tender there.
A little, yes, it is.
So you've really got to be thorough with the esophagus. Quite often you find that there's an area of like hard, dry skin over this particular reflex. And it then lends the question about, do you suffer from acidity or heartburn, or...
Not usually, no.
Do you eat fast?
Sometimes, yeah. Sometimes I do eat in a hurry.
So it could just be something as simple as that you can advise your clients to be more mindful of eating, because your esophagus is telling us that it feels tight. And you have a little point there. If you push up and under where the esophagus begins, it's a little trapdoor called your cardiac sphincter, which often can be really tight, like any muscle. It can hold tension, and then if it's tight, then it can let acidity come back up through the esophagus. So again, another reason to sort of slow the digestion down, isn't it? To really work in a very calm, rhythmical manner when you're working over your abdomen. Okay, so I'm going to work the pancreas now, and you've got a point on the big toe where you've got the spleen and pancreas meridian. I'm going to work the two together. And then this lateral side of the big toe, you've got a liver point for the liver meridian, and I'm going to add that with working the liver. Good. Then on the fourth toe, you've got a gallbladder meridian point, and I'm going to add the gallbladder. And I'm also going to work the gallbladder on the dorsal aspect too. So there's 3 points I'm going to work the gallbladder. How's that feel?
It's a little tender, particularly on the toe.
Yeah, the reason why I ask, it feels like there's a lot going on there, and I'm sure all of your, your quiet mind, your intuition always feels that something feels just maybe a little bit tight, maybe just a bit tense, or it could even feel empty or depleted. You just feel that there's a difference that makes you want to work it a little bit more. So I've held that for a good 10 seconds. And then we come to all this area going towards the heel. So all of that's the intestines, isn't it? So it's really nice just to slow your movements down. I'm sliding my thumb over the intestines. I can come back using the other thumb too. A nice technique is actually to use a stick and roll it over this area, as people often do with their foot massage tools at home.
Or a tennis ball.
Tennis ball is also good. And then we come to the large intestine. So being really specific on this point here, the ileocecal valve. Working up to the bend at the liver, the hepatic flexure, and again spending that extra time working that point. And then we go across for that transverse colon. And because that all feels fine, I'm not going to go over it again. The bladder looks just slightly more puffy than maybe I would expect. So I'm going to check it first. Feels okay?
Yeah, a little tender.
So that might even relate to the congested lymph. There's a point on the little toe for the bladder meridian, just in front of the nail. So I'm going to work that. Assess that first. How's that?
That's okay.
Okay. And then work that with the bladder too. And let's check the kidney, which is found directly underneath where you find the base of that first metatarsal bone. If you're not sure where that is, it's always in line with the fifth metatarsal bone. So fifth metatarsal bone is here. You can usually feel it really well on most people's feet. Draw a line up and over the foot and you will come to the first one. They're all in line. They're all pretty much equal length, those metatarsal bones. So the kidney is found directly underneath that first metatarsal bone. You're sort of pushing your thumb up towards it, and it's really easy to find that kidney as a reflex there. And interesting, on Anna's feet, it feels a bit congested. Remember, we can't be diagnostic, we can't, say exactly why maybe the bladder, the kidney and the lymph all feels a bit sluggish, but it all needs a bit of extra work and extra servicing. So hopefully this can just help to increase all the circulation to the area, increase the nerve impulses to the urinary system, help to clear the congested lymph, and hopefully everything just starts to work more efficiently without anything getting worse or need for medication or causing any particular symptoms. So that's the art of reflexology, isn't it? We are just releasing the congested, tight areas so everything can work more efficiently again. And already that kidney reflex feels easier. That's good. Okay, last couple of bits for this right foot. I'm going to work up just 1 millimetre above the kidney for the adrenal glands. And I'm looking at Anna's face to suggest, yes, I think I found that, because it's obviously a sensitive area and it should feel differently than the kidneys.
Sorry.
It's just Yeah, 1 millimetre above. So I've got the adrenal glands, and now I can add on the pituitary. And hopefully you all have your own method of finding the pituitary, and there we can work the two together and hold that. Make sure you hold and let it respond. It's often sensitive, isn't it? And it's often painful for most people, but it will release.
Yeah.
Unless, of course, the person's got very high stress levels, then I would be a lot more gentle with these areas, because they probably wouldn't release at all. So what did that start off as?
I would say that started off as an 8 out of 10.
Okay.
And it's probably about a 3 now.
So that's really significant, isn't it? That it already, with my very firm, you could say authoritative pressure, I haven't released it at all. It's got a lot easier. Then I'm going to find the vagus nerve again, back up underneath the thyroid, and I'm going to go a millimetre above, just find the pituitary again, a millimetre above for the hypothalamus. And then I'm going to work those two together as well. And that's got a reaction from Anna to suggest that they've definitely found those two. And again, the hypothalamus is often very sensitive. It works very hard. It's the hardest working part of the brain, you could say.
Almost immediately.
So that's great.
Yeah.
It's immediately eased. And then the last point I'm going to work on this big toe is the pineal gland. So I've just gone to the side of where the hypothalamus was. Pituitary, hypothalamus, pineal. Okay, and release. So I've got a couple of minutes left on this foot. So I really want to just feel everything again. And I know you might be thinking, I haven't done a few reflexes, such as like the parathyroid, the thymus. I haven't done the thyroid. I haven't done the reproductive organs. I've spent my time focusing on the musculoskeletal, the pelvic area, neck and shoulders. These are all things that we discussed before we started the treatment. So I've prioritised my time to really work those. And if maybe the thyroid had come up in conversation, or maybe like low immunity, I'd have worked with thymus. So I've been targeted in what I've worked in this half hour or so today. Just going back to the ear. Check the kidney again. And the stomach was slightly sensitive. And that lower esophagus. Okay, all goes pretty good. We'll finish off with the lymph. So I hope that helps you to just be a little bit more fluid with your treatments. The last thing, just to add this on, that you can also use tuning forks and vibration in your work. And it's quite nice to go back to maybe the most congested type reflex that you found in the treatment and use a vibration on it. So it feels like the sacroiliac joint to me. So I'm going to hold this point of the tuning fork onto the reflex that I want to target, and then you just send a vibration through it. And it's such a lovely feeling to experience. You just feel this vibration going through all of the, muscles, soft tissue, bones of the feet, but it's sending messages also via, that reflex to the brain to do something about this information. So this is a particularly nice way to work, especially if somewhere is particularly acutely painful. You can send vibration through it too. And just one more time. So it feels like I've really thoroughly worked everything on that foot. So let's go to the left foot. Right, I'm going to wrap that one up. Okay, and we can bend your foot. Let's go that way, yes. Okay, so we've already put some balm on, and let's start working the lymph again. And again, it's all this pelvic area that I really want to focus on. Get all that to move. Coming down, working that sciatic nerve. These tight pelvic muscles here. You see how that looks all quite inflamed, doesn't it? And we want to pull that leg out again. And lift the heel up. Let's work the pelvic area like that. This feels tighter, this pelvic area on this side, more than the right foot. Just that tendency that you've got this slightly longer leg on this side, so whether you weight bear more on this left side, standing more, to the left.
Probably, yes.
As you're doing your work.
Yeah.
So that's always really a key thing that clients, can take away from reflexologists. They can have an awareness that maybe they do possibly weight bear more on one side to the other, causing that just slight pelvic misalignment. So maybe be more mindful.
My pedal is the right foot, so
Ah,
I lean on the left.
that makes sense. It's a Potter. So using the wheel, you're stood with your left and the weight on
I
your
sit
left.
with my right foot on the pedal, and then I lean to the left when I throw.
Yeah, and it just feels that little bit tight, all these muscles of the pelvis, this side. Okay, let's do this technique of working the spine and the joints again. And the knee feels tight. And on this side, the medial side, I can feel again that the lower thoracic and lumbar need a bit of extra attention. So don't be afraid to be firm with the feet. I personally think it's more torturous to be light in pressure. When it's ticklish and light, it can be just really uncomfortable to be on the receiving end of that than being firm. So I'm really firmly going over the joints of the knee and the elbow and the hip. I'm going to try and loosen up the lower back and hip at the same time, doing that. 2 fingers, index fingers at the same time at the bottom of the heel. The heel itself is all the gluteus maximus muscles, isn't it? So, using a stick, I'm going to try and loosen those muscles. Hopefully not ticklish, just feels
No, it's great.
firm. The heel is a really neglected part of any reflexology treatment, so you really do need a stick to work this area, or use your knuckles, because your thumbs or fingers just can't work this tough part of the feet very effectively. Okay, feels easier. Let's go to neck and shoulders then. So let's really work that shoulder. It really is creaky, very congested. Always nice to do that technique. Shoulder sandwich, and it really loosens up all of those metatarsal bones, as well as really working on that shoulder area. Let's add the neck muscles to that, as we did on the right foot. the big toe is just that little bit away from the midline, so I'm going to hold the base of it and do some really slow rotations, both clockwise and anti-clockwise. You often find that the toe wants to turn easier one way than it does the other, and you are trying to loosen that up. And then let's work right at the top of the big toe, where you've got the joint of the big toe, where would be C1. Just up from that, you've got the brain stem. Everything has a reflex on the feet. Every single part of the anatomy will have a point that represents it as a reflex. It's all very tight around C1, C2, so that's why I'm spending a bit extra time, and you can see that on those sides of the big toe. Okay, and we'll do the lymph next. So if I wasn't talking and describing what I'm doing, my intentions would be a lot more focused. So as I'm working the lymph, I really want all that water to flow and move, and all that energy that everyone has, you know, flowing through their body, through all the meridians, is to flow freely. So the movement and flow of everything, water, blood, lymph, just to flow unimpeded. And work the diaphragm again. So every treatment should be different, shouldn't it? And if I saw Anna again, I'm sure I would work in a different order and work on different things depending on what she told me before we started. Okay. And solar plexus. Is your foot relaxed? Solar plexus with the addition of the throat. And releasing any congestion in the lungs. And feels a bit clearer actually, the lungs on this side. And just spending that additional time on the heart, which again, that heart reflex does have a slight build-up of hydraskin, but interesting that it was more so on the right foot. So always applying that kind of philosophy, if you like, that the right foot represents the past state of health and the left is more the current presenting state of health. That sometimes makes a lot of sense. Things that have been in the past don't necessarily always present on the left foot being the present. And certainly that feels like easier, feels fine. Okay, I'm going to do the esophagus next. And again, it's tight at the base of the esophagus. I have to be really quite firm and using really like a really precision of my thumb to work that part of the base of the esophagus, and then pushing up and under to get that point where you find the cardiac sphincter. Tender?
Yeah, that's quite tender.
So there's just a millimetre movement on my thumb, and I've really hit the spot where it's
tiniest movement.
just really quite acute.
Yeah.
And I'm going to hold on that point. I might come back to that point later with the tuning fork and the vibration. Hopefully it feels a bit easier. You're still tender.
Still quite tender.
Okay. Let's watch the vagus nerve. So really you can work anything in whatever order. And it's quite nice to shake things up a bit and don't have to do it in the order that you learn. It's a checklist, isn't it?
Yeah.
When you learn your routine from whichever school you've trained at, there'll always be like a routine that you follow, and that's good to do like on the first treatment because then you are checking everything. But then to be able to just be more creative and do things in a different order and go with the flow a little bit more tends to make reflexology a bit more dynamic. How's that vagus nerve?
Fairly tender, I would say. About a 6 out of 10.
Okay, this is what the diaphragm. And again, I'm going to work very slowly over the abdominal organs, starting with the stomach and also adding on the stomach meridian point on the second toe. Go down to the pancreas and then holding the edge of the outside of the big toe, I've got the spleen stroke pancreas meridian, which I can then add on the spleen as a reflex. And then we come down to the small intestines. Finding that fifth metatarsal bone, I know exactly where to go along the transverse colon. Extra tension spent on that bend at the spleen, the splenic flexure. Going down, descending. Bend at the sigmoid flexure, and then slightly up and back down again at the end of that last part of the large intestine. Okay. Now I know you won't be able to see the bladder reflex, but I'm just going to work the bladder reflex and add on the bladder meridian, which you can see really clearly from this angle, right on the side of the nail of the little toe. Exactly there, you've got that bladder meridian point. So I'm going to work that with the bladder. And it's tender on this side. This is interesting because I was expecting it to be tender on the other side, because of your slightly like inflamed looking bladder reflex. So it's interesting that it is out of balance and more uncomfortable on this side.
Yeah.
And it's all about the flow of water, isn't it? And it feels like that is something I want to really focus on, with the flow of the lymph and the bladder and the kidneys all presenting. Held that for like a good 10-15 seconds. I'm going to then find the kidney using the base of that first metatarsal bone. I can then aim the kidney reflex to be up and under it, as I showed you on the other foot.
No, that's fine.
It's not as congested, the kidney, on this side. Okay, but then I can find the adrenal glands. literally 1 millimetre above, and then add the pituitary on. So if you can, let me just swap hands, adrenals there. So because I'm on the left hand side, I'm going to work the pituitary sideways on, imagining this clock behind me that says 10 to 10. So my direction is that direction. Okay, and I found it, and there we go. We're going to hold the two together, adrenal glands as well as pituitary, calming all of that adrenal stimulation down, calming all of the fight or flight that we all have generally too much of these days. Okay, easier. So what did that start off as?
8 or 9 out of 10, I would say. It was quite intense.
Okay, and what is it now?
3. I would say.
Okay, that's
3,
really
4,
good, isn't
3.
it? Great. Then I can just move my thumb on the big toe a millimetre above to find the hypothalamus, and then add on the vagus nerve. Just that slight little adjustment of the angle of my thumb, and I found it.
Yeah.
Okay, and then just one more movement of my thumb on the big toe. I'm just going to go to the side of those other two, and I found the pineal gland. There's a lot of variations where you find the pituitary, hypothalamus, pineal on different foot charts, and all I can say is experiment with all of them. See which one works for you the best. They could all be valid. So I think you've got to just have an open mind with a lot of these areas and reflexes. Is try them and maybe work all of them. Okay. I'm actually going to work this point here at the top of the big toe, and it's where you've got the frontal lobe of the brain. I didn't do that on the left foot, but I feel I want to do this on this right foot, and it's like a screwdriver technique of my index finger. And more than often than not, it's a really quite a congested part of the big toe. And I always think it relates to the frontal lobe works really hard, making all of your decisions. It's problem solving. It's the kind of logical, higher intelligence part of your brain that is kind of like making all the sort of mathematical decisions. And it often is overworked, where people often have a lot of maybe mental stress, a lot of things to think about, maybe a busy mind that never stops. Would that relate to you?
Definitely.
Okay, so we've established that that's quite possibly the case. So it makes me want to go back to the vagus nerve again, because the vagus nerve really is just that calming influence on the brain by stimulating that vagus nerve reflex. It's sending messages to the brain to be in a calm, relaxed, parasympathetic rest and digest state, and hopefully just calming that busy mind down. So I've got about 7 minutes left. I'm going to stick to an hour. So I'm going to spend that doing the most relaxing techniques. Really working the lymph, which again still feels like it needs that bit of extra attention. Really working around that. You can see there's still the sacroiliac joint, but I'm being slightly more gentle. I want this to be just the last part and more relaxing. So really you can approach reflexology two ways, can't you? You can be as firm as stimulating as I have been today, and I've been asking my client their response and asking them questions, so they'd be much more involved in the treatment. If I felt it was more necessary for them just to completely relax and let go, if they were particularly stressed or anxious, then I would change the focus of my treatment and make it much more relaxing, gentle treatment, so they do get to that deep state of relaxation. So you can change your intentions to how you work. The important thing is to adapt to suit this client and for the best benefit for the client for that day. So it's good. It all feels easier around the pelvic area. And the neck feels loose there. Pull that left leg, loosen that bit one more time. I'm just going to check that base of the esophagus just one more time. And I'm using my tuning fork. And the point that we found was the most congested on that base of the esophagus. Okay, those vibrations last quite a long time. So the one in the frequency of Om, which is 136.10 hertz, is a very good frequency for healing and used by a lot of therapists. So last couple of minutes, and I'm going to get the right foot back again. Let's get both feet back together and assess the alignment of the heels, and still just the slightest difference with that left leg, but it was improved. It was less of a difference. Just want to get both the feet back together again. If you practice Reiki, it's quite nice to just finish with a couple of minutes of Reiki, or just to hold the feet and set one final intention. Okay, and then most reflexologists finish off with the solar plexus breathing, and that's a nice way to finish and bring an end to a treatment. So if you would like to take 3 deep breaths in and out when you're ready. So at this point, I'm going to just say, I'm just going to wash my hands, so stay there for a minute. And I hope all that's been useful for you to be able to be just a bit more flexible in your treatments and experiment a little bit. Have some fun being creative, using maybe vibration, maybe a wooden tie massage foot stick, and just be more fluid with the order that you do things. And I think your intuition will really be allowed to work more efficiently when you're just being guided through the feet. So I hope that's helpful.